scenarios. B has little relevance in low resource scenarios. C, A, and B. Ten seconds. Hormone receptor testing is largely unavailable in low resource scenarios, has little relevance in low resource scenarios, or A and B. There's still some trickling in. Okay, here we go. So, most say A. It's largely unavailable, but very few think that it has low relevance. Let's see where this goes. And so we have as our moderators for this session, again, Clement Adebamawo and Dr. Julie Graylow, my colleague from Seattle. Clement, if you could go ahead and introduce our first speaker.
Thank you very much, Ben. I'm sure Dr. Graylow needs no introduction, so I'm just going to talk about Dr. Hannes. So, Dr. Jay Hannes is president of Breast Surgery International and a past president of the American Society of Breast Surgeons. He's going to be talking to us this morning about the use of ultrasound to improve cancer evaluation in low-income settings. And is eminently qualified to do this because he's the lead author of the textbook, Ultrasound in Surgical Practice, Basic Principles and Clinical Applications. Dr. Hannes, thank you. Please.
Well, thank you very much. This is the first global summit that I've attended, and I must admit that I'm really impressed with the quality, not only of the people who are here, but the quality of the talks given this morning. It's one of those things with PowerPoint where you can sort of alter your slides and what have you. And I'm sitting here this morning thinking, based on what I heard this morning, I would probably redo this talk almost completely. It's really an overview about ultrasound for those of you who are not that familiar with it. Ben, I think it's true that in one of your prior publications you've really advocated for ultrasound, correct?
Yes, actually in our guidelines, ultrasound is the first imaging tool that has been suggested. It's at the limited level for mammography.
I don't know if everybody could hear what Ben said, but in your previously published guidelines, it's really actually listed as the first imaging tool. I'm here to say yay to that, absolutely, and I think I'll try and show you why. I'm fully aware of the locally advanced breast cancers that are primarily, seen in limited resource countries. On the other hand, ultrasound is such a fundamental tool for not only surgeons, but also potentially for non-surgeons. So breast ultrasound, I think one of the fundamental points about breast ultrasound is that it's used as an adjunct to the physical examination. This is not only of the breast itself, but also of the regional nodal basin, axillary, supraclavicular, cervical, so that as you'll see in a moment, we can then use ultrasound to help guide us when it comes to doing biopsy procedures. Also, for those of us who use ultrasound on a regular basis, we use ultrasound in the operating room to help guide surgery of non-palpable cancers and for a variety of other reasons. Ultrasound is a less expensive imaging technology that can not only be used for the breast, but if you have the probe for what's called small parts, you can use it for thyroid, inguinal regions, superficial, and with equipment, it's not that much more expensive to also then have an abdominal probe that has a wide variety of uses, not only for the liver, pelvic organs, etc. The newer machines are smaller. Interestingly, GE is one of the co-sponsors of the Global Summit. They're more portable, less expensive, And really importantly, good used equipment is available. Believe it or not, there are actually very good analog units that are still out and about that can be sold and reused and give very adequate imaging. And so these kinds of this kind of used equipment could actually have wide applicability in the resource less available environments. I think very importantly, and are there any radiologists in the audience? Aha, we have one. Well, no, I'm not going to have you stand up, but anyway. I'm about to say you don't have to be a radiologist or a radiology tech to learn how to use the equipment and to interpret the images. I think you do need to be a qualified provider of some sort. Surgeons, as I'll mention in a second, are very natural ultrasonographers, but certainly nurse practitioners and PAs can use it, can be properly trained to perform breast ultrasound. Interestingly, in the 15 years I've been involved in teaching breast ultrasound, what we have found is that surgeons, by and large, are intimidated by the machine, are intimidated by the knobs on the machine, and then are intimidated by the black and white pixels that they get. But once they get all three of those things, they take to ultrasound like the proverbial duck to water, because it makes sense once they get over the feelings of intimidation. Ultrasound can characterize masses in the breast. It does more than in the old days we said, well, is it solid or is it cystic? That was some of the earliest applications. But certainly is a lesion single or multiple, can give accurate measurements of the targeted lesion. And then what we talk about are characteristics and features that we get with ultrasound images. Now in this 15 or 20 minutes that I have to talk, I obviously can't give a whole lecture on this. But there are certain characteristics that we see with ultrasound that are benign characteristics, excuse me, and certain characteristics that are certainly malignant. And interestingly, I don't know in limited resource environments how many patients present with nipple discharge, but imaging the ductal system for causes of nipple discharge is another important use. Basic training in breast ultrasound can be done in a one-day, 8-hour course. Now, the radiologists in the audience will jump up and say, well, that's absolutely preposterous, that you can learn all of that in one day, right? Her head's going up and down, absolutely correct. This is only the beginning. Follow-up utilization of the skills learned at the courses is critical to become comfortable with the technology. But remember, we're learning this technology with a background of some level of knowledge, particularly for surgeons, the knowledge of what a cancer is like versus a fibroadenoma, what a phylloides lesion may be like, what malignant lymph nodes may be like, etc. So I'm not suggesting to you that you can become an expert in a one-hour course, or one-day course, but what you can do then is to begin to utilize the technology as an adjunct to your physical examination and bring the two together. Courses are currently offered by various colleges of surgeons, including our own here in the United States. I'm aware of the Royal Australasian College of Surgeons in Australia and New Zealand. Hong Kong is offering courses. There are, I'm sure, many courses that I'm not aware of. And there are breast surgery organizations around the world, not the least of which is our American Society of Breast Surgeons, that has very structured courses that we